and do a test. So my name is Ken George, and I'm here from Beard and Talk Marketing, and we're going to do a little show on healthcare. So today, 44.3 million Americans are on Medicare. These are the numbers from current data that I collected over the internet. Most of it's from 2010. A little bit of 2009 stuff is inserted in there where I couldn't get the 2010 numbers. And I don't have all the sources listed on the, I don't have any sources listed on the data here, but I do have all the sources in my files. So today, there are 44.3 million Americans on Medicare. In 2010, Medicare spent $523 billion on those 44.3 million Americans. That works out to $11,885 and $805 per person per year. Now, let's talk about poverty. I'm going to have this little blurb in here a lot. The government defines poverty as income at or below $23,050 per year. So if you make below $23,000, you are considered to be in poverty. Now, what are the Medicare demographics? Remember some of these numbers because we're going to use them later when we talk about the subsidies. The income levels for people 65 or over. 14% are at or below poverty. 28% are between 1 and 2 times poverty. That means they make somewhere between $23,000 and $46,000. 16% are between 2 and 3 times poverty. 17% are between 3 and 4 times poverty. 10% are between 4 and 5 times poverty. And 15% are over 5 times poverty. So 5 times poverty is a little bit over $100,000 a year. Net worth, because this will be a factor in how we distribute the money that we spend. If you're in the bottom 20% of people over 65, you have a net worth of less than $3,000. Now this excludes your home. If you're in the second 20% of people over 65, you have a net worth less than $27,000. The third quintile is less than $85,000. The fourth, $135,000, and the fifth quintile has a net worth over $300,000. All right, so let's talk about the second group of covered Americans. These people are on Medicaid currently. Now, how many? There are 57.3 million Americans on Medicaid in 2010. 2010, Medicaid spent $401.4 billion. How Medicaid is paid for, part of it comes from the federal government and part of it comes from the states. And every state has a little different formula that they use to calculate how much they got to pay and how much the federal government, but it's generally 3/4 and 1/4. Now, what are the Medicaid demographics? Again, the government defines poverty as income at or below $23,050 per year. Eligibility for Medicaid, it varies from state to state, but it's generally between 133% and 150% of poverty. And so the people that qualified for Medicaid would either be at poverty or slightly above, or it could be below. And we spent $7,005 per year per person. That's what that $401 billion divides out to. Now, in order to be on Medicaid, the net worth would exclude your primary residence, your personal belongings, one motor vehicle, property that is essential to self-support. I suppose that would be things like a lawnmower if you were cutting grass, or tools, things like that. Certain burial arrangements, in other words, if you have plots and things like that, they exempt those. and assets held in specific kind of trusts. So if you exclude those things, the rest of what you have can't exceed $3,000. Now, why this is important is because a lot of Medicaid is being used today for people in nursing homes. And they give away all their assets so that they can get the government to pay. So they've tightened up on some of those rules. But if you have net worth, then you're going to have to pay some of that net worth for your care in the plan we have today in Medicaid and the plan that I've proposed. Now, the next group of Americans that are covered by federal or state dollars, or government dollars, is S-CHIP, or it's called the State Children's Health Insurance Program, S-CHIP for short. There are 5.2 million kids on S-CHIP right now. In 2009, S-CHIP cost $10.6 billion. Again, there's a $23,050 poverty. The eligibility, your parents can make between 200% and 300% of poverty, which is somewhere between $46,000 and $70,000 per year, and you can still qualify for S-CHIP. In New York, it's 400% of poverty, so that means your parents can actually earn $92,000 a year and still qualify to have their children's insurance paid for. Fortunately, it's not an expensive insurance policy. It's only $2,038 per child per year. Fourth group of Americans covered by government insurance: veterans. There are currently 22 million veterans, but only 11 million of them use the VA in some way. In 2010, the VA medical cost was $47.7 billion just for health care. The eligibility, obviously you have to have served in the military, and that $47.7 billion works out to $4,336 a year per person. Fifth group, federal workers. Now, federal workers do pretty well. The average salary for a federal worker, this is the average, is $82,200 per year. There are 4 million federal workers covered by this insurance. In 2010, workers' medical cost was $10.1 billion. The eligibility, you got to work for the federal government, and this insurance cost us $2,525 per person per year. So let's put these numbers together. I'm going to show these things fairly quickly. So the total government expenditure for all 5 of those health programs, $992 billion. That's only $8 billion short of $1 trillion, by the way. The total number currently covered, 121,800,000 Americans. That's somewhere between 1/3 and 1/2 of our population. The amount spent per person covered, $8,151 per person per year. You can buy a lot of insurance for $8,000 a year. And the average cost of an individual health care insurance plan, this is in the private sector I'm talking about. What would you guess? 6,000? 5,000? How about $2,580 per year? That's for an individual. That's the average health care premium for an individual policy in America today. That took me a long time to find that. There's a lot of places I looked, and a lot of places give you different numbers, but they average anywhere from $2,300 to $2,800. But I'm pretty comfortable that that's a pretty good average. Now, it varies from state to state, and that's one of the reasons Paul Ryan and the Republicans want to allow people to buy insurance wherever they can, because it is different from state to state. And a lot of insurance companies have monopolies in those states, and they can charge whatever they feel they can charge. Oddly enough, the state with the highest insurance premium for a private policy is Massachusetts at $5,244, almost double the national average. And the place in America where the insurance is the cheapest for a private policy is Alabama, where it's only $1,632. So you can see you got a wild swing of costs for insurance, the average being $25.80, but that wouldn't do you no good if you lived in Massachusetts, because that policy would be very much more expensive. So now let's just do something here. Let's take the 49.9 million uninsured people and plug them into the people that are currently being covered. So now what's the amount to be covered in any new insurance policy? Now it's going to be 171.7 million. Now, one thing to remember, that's more than half the population. And you know what the old saying is: when more than half the people are getting and less than half are giving, the ones that are going to get that vote will vote themselves more. So this is getting to be a very dangerous place for America to be, having more than half their population being covered by government or government subsidized insurance. So how much do we have to spend with $992 billion, and now we have 171 million people to cover? We still got $5,782 per year per person. That's more than the highest policy of Massachusetts, and it's 2.5 times more than the national average. So let's do something else. Let's cut the $992 billion down to $800 billion, so we can actually reduce the amount we spend on health care from a governmental standpoint. The amount spent per person then would be able to be $4,659 per person per year. That would be the average amount. Some are going to get less and some are going to get more. So here's the plan. Here's how you do it. Before you start the plan, though, you have to make certain assumptions. I'm only one guy, and I don't have the resources, the time, or the expertise to break these down, these numbers down into finite little numbers. So I had to make certain assumptions. Assumption number one was that all persons on Medicaid fall below the poverty line. You remember that I showed you some were 133% of poverty, some were as much as 150% of poverty. So I don't think that that's going to make a huge difference. So basically, we're going to just assume that all persons on Medicaid make below $23,000 a year. We're also going to assume that 25% of all Medicaid patients or participants have a pre-existing condition. 50% of Medicare participants, so those over 65, have a pre-existing condition. It's important that this pre-existing condition stuff is important because people with those conditions have to pay more for their insurance. So we're going to subsidize more for those people that have pre-existing conditions. Now, oddly enough, the people that are uninsured, according to a study I read, they only estimate somewhere between 100,000 and 300,000 of the uninsured have a pre-existing conditions. It was stated that it's because that's why they're not insured, because they're usually healthier people, younger people. It's not always the case, but we're going to use, for this exercise, we're going to use 200,000 of the uninsured have a pre-existing condition, and all veterans have a pre-existing condition. I guess if they didn't, they wouldn't be using the VA. But you got to remember, there's people that were in World War II, people that were in Vietnam, they're in their 60s. They're using the VA. They don't necessarily have a pre-existing condition, but they go there because they can, and it's paid for by the government. So for this purpose, though, we're going to say that all veterans have a pre-existing condition. Now, what we're calling this is a means-tested subsidy, but Paul Ryan and the Republicans, they call it a voucher. Same kind of thing. Basically what a means tested subsidy is the government will subsidize your private insurance based on your income and net worth. So here's how my subsidy program works. You go out and buy your own private insurance wherever you want. You have up to a certain amount of money to find that insurance that you can afford based on that amount of money. So if you're at or below poverty, $23,050 per year, the government will subsidize your private insurance. In other words, they will send the check to your private insurance carrier 100%. They will pay the entire bill when it comes for your private insurance. So you go out and buy what you want up to a certain amount of money that is set by your income and net worth, and the government will pay that bill 100%. Now, if you make between 23 and 46, the government will pay 98% of that bill. So you're going to have to pay 2%. If you make between 46 and $69,000 a year, we're still going to pay 95% of that bill. But you'll have to pay 5%. You make between 300 and 400% of poverty. In other words, you can make up to $92,200 a year and we'll still pay 50% of your premium up to a certain amount. Now, here's the means tested part. If you make about 400% of poverty, in other words, if you make more than $93,000, you're on your own. You need to furnish your own insurance. Now, you don't have to buy insurance. There's no mandate that tells you have to get it. But when you go to the hospital, you're going to have to pay. And since you make $93,000 of income, if you don't pay, they're going to come after you. And they're going to be able to get their money. So the hospitals no longer will have to not collect money for service. And the second determining factor is net worth. So for every $50,000, and this could change, you want to make it 100, you want to make it 200, whatever you want to make it. It's just every $50,000 of net worth reduces your subsidy by 10%. So for example, in that 300 to 400% of poverty, people making $90,000 a year, they get 50% of their premium covered by the government. But if they have a summer home in Florida that's worth $100,000, then they're going to lose 20% of that 50, knocking it down to 30%. So the net worth will have a bearing on how much you get. Again, that's what's called mean testing. Now, here's how much we're going to give them. Using $2,580 per year as an average policy, we're going to increase that right off the bat by 25% to $3,200. Now, going along with that are the things that the Republicans have talked about allowing you to buy insurance across state lines, allowing tort reforms so that insurance premiums are less, all those reforms to the actual health care industry that will help competition grow all over the country. I would go so far in my plan to allow anybody to be an insurance company with the one caveat that they have 50% of their premiums go into a bonded account to cover losses in case they go bankrupt. So there's ways to structure this very simply that don't require a lot of legislation to allow competition to flourish. My guess is that $3,200 base amount that we're going to be using will be more than enough to cover everybody. Now, people that are over 65, they're going to pay a little more, but so what we've done is those over 65 will get up to 150% of that subsidy. So in other words, up to $4,800 a year. And if they have a pre-existing condition, they get double that $3,200 or $6,400. That's how we take care of people that require more and not pay as much to those that require less. So this is what's means testing, or a voucher program. still, I just think that everybody's going to be covered, and there's going to be very little out-of-pocket cost. If anything, it'll be a small deductible or copay or things like that. And another thing you have to remember, this is per person. So per person changes a lot of things. In other words, typically a mother with 4 kids, single mom with 4 kids, she's looking for a family policy. That the highest family policy I could see was in New York. It was a little over $13,000. But generally they don't count your kids. They just charge you a family rate, which is generally based on 4. So if you have 3, you still got to pay for 4 and blah, so forth and so on. But this single mom with 4 kids living below poverty would have available to her family $16,000 a year for private insurance. So she would go out and get a private family plan for her kids and herself, and we would subsidize up to $16,000 per year for that private insurance policy, which probably wouldn't cost that much, but that's what's available to her. Now I'm going to fly through the rest of these numbers because they're small and they're hard to read because they're so spread out. But this is basically the breakdowns of the various income groups, demographic groups, and net worth calculated in. And so bottom line, this first subset of numbers is for the people over 65, people formerly on Medicare. Now Medicare goes away because we're going to subsidize their private insurance now. So basically these are the amounts they get if they're below poverty with a pre-existing condition. They get $6,400 per person per year for their private insurance. If they don't have a pre-existing condition, if they're reasonably healthy, they get $4,800 per year per person. So a couple that was reasonably healthy, it was 65, 67 years old, they would get $9,600 a year for their private insurance. People that had heart condition or diabetes or something like that, they would get up to $12,800 a year per couple, $6,400. And then it breaks down by income all the way down to if you're making if you're making over 300% of poverty, if you're making over $90,000 a year and you have $200,000 in net worth, your subsidy goes down to $2,240 per person per year if you have a pre-existing condition. So that's all just broken down by demographic there. But the total is $178 billion for people over 65. This is for the people that are currently on Medicaid. Long story short, they either get a $3,200 subsidy or a $6,400 subsidy, depending if they got a pre-existing condition. And I broke that down by the 25%. So the total for those people are $229 billion. These are for the people on S-chip. I just put them, since the insurance currently was only $2,000 a year, it's now $3,200 a year available for a cost of $16 billion a year. This is for the veterans. Oddly enough, this went way up. It was $47 billion. Now it's going to cost $70 billion because we're going to buy their private insurance 100% and consider them having a pre-existing condition. Now, I would assume that a lot of them can buy insurance a lot cheaper than $6,400 a year. So there may be some savings there, but just so that we make sure we're covered, $70 billion for veterans. And then the federal workers, there's no reason why they shouldn't participate in the same arrangement that everybody else is participating in. So there's 4 million workers. We're going to, and remember I told you the average pay was $82,000 a year. We're going to assume that 1 million of them make less than $45,000 a year, or 200% of poverty. So they're going to get a subsidy of $3,136. They're going to be covered 98%. Then there's going to be another 1 million that are going to make somewhere between 90 70 and 50. So they're going to get a $2,880 subsidy, 95% coverage. And 2 million of them are going to be making above $90,000. So they're going to get a $1,600 subsidy, and they're going to have to pay some of their own insurance. So that comes out to $9,216,000, and that's about what we're spending now for that, about $1 billion less. Now here's the uninsured. Again, I looked up the demographics, and this is the number of people in each category. And so the vast majority are making less than or at or below poverty. So there's $92 billion just for those people, $3,200 per person per year. And then there's a fair amount at $3,100, 98%, and a certain amount at 95%, and some at 50%. And then there's the 200,000 of people with pre-existing conditions. So there's another $143 billion we have to spend for the uninsured. But everybody's on the same plan. Everybody buys their own insurance, whatever they want, up to a certain amount of money. So $3,200 is the key, and $6,400 if you get a pre-existing condition. So it's to be seen whether or not private insurance wants that 50 million more people. And if they do, they probably will lower their premiums if we allow more competition and we allow somebody else to administer it, the program, like American Express or Visa or somebody like that, to just get the bills, verify that they're accurate, and send the money right to the insurance company. So there's nothing that, there's only the insurance companies would have to be audited or made sure that they're accurate. So don't have a lot of third parties in here other than the insurance companies. So here's how it breaks down. $178 billion for Medicare for people over 65, $229 billion for the poor, $16 billion for the kids on S-chip, $70 billion for our veterans, $9 billion for our federal workers, and $143 billion for the uninsured. You add that all up, it comes out to $647 billion, which is $153 billion less than we budgeted. So the other $153 billion we use to administer it. We use it for growth. In other words, if things started to rise, and we'd use it, but I really doubt that that's going to happen. I think that actually things are going to come down, not go up, with this kind of a system. And at the same time, hospitals would be reimbursed for those idiots that choose not to buy insurance even though they can get it paid for. But the government would go after them for their portion if they didn't pay. In other words, let's say a 30-year-old guy, perfectly healthy, doesn't buy insurance, he doesn't want it, he doesn't want to spend the money, even though he doesn't make much money, he could get 95% of it paid for, he still won't want to spend the 5%. He goes in the hospital because he got in a car wreck, the government will reimburse the hospital for that, not an insurance company. And it'll come out at $153 billion, but at the same time, the government will go after him for his 5% and make sure that he has to buy insurance in the next year. So he'd have to fork over his 5% for the next year. So that leaves almost $200 billion a year to reduce the deficit. Now, I'm certain I don't have all the details in this plan worked out, and I'm certain that I'm no brainiac that can understand how everything works. But these are gross numbers. These are giant leaps, but it is based on what I could dig up statistically and what I could dig up based on what we've already spent. So there's a lot of good work here, and it just seems possible to do this for a lot cheaper. And this doesn't even take into account that 30% of all medical costs go to people that don't pay at all. When they never pay, the rest of us have to pay more. It's called cost shifting. And if everybody in America was covered, if everybody had insurance and everybody paid every time they got care, that 30% would disappear. Now, whether or not the hospitals would pass that along, that's probably doubtful. But if I was president, I would call all the hospitals, the big hospitals together, and tell them that, this is what's going to happen, and this is what we expect. So I think medical costs would begin to come down if you had a system like this. I know insurance would definitely come down. You got 50 million more customers that are paying. The demographics alone will dictate that you don't need to get as much per person. And so I think that this is a really good approach to healthcare, and I think we really could make this work if we just got the government out of it. All they have to do is send the check once a month to American Express or to Visa and let them administer it and pay them to do it. That would create more jobs there. It would reduce the amount of jobs in the government, and the government wouldn't have to have nothing to do with any of that stuff anymore, except for paying the bills. And it just seems like the way to go. Anyway, that's my little presentation. I hope you enjoyed it and learned a little bit. And next time we'll talk about another big issue in America. Thanks.